Welcome back. This might be a problem. Tonka's left leg is getting worse. Yesterday we noticed he had a slight limp, but figured he'd be over it the next day. Unfortunately, that's not the case. See how he's favoring his left leg? He doesn't want to put any pressure on it. This could be one of several things. Hopefully, it's just a sprain. But with a dog his size, we have to be concerned about a torn ligament, muscle, tendon, or even a bone fracture. It can be difficult to diagnose. Sometimes it looks like it's his paw. I've checked closely, and there's nothing in his paw, nothing in between the pads. I'm guessing there's an issue with his elbow or shoulder. He's becoming more and more uncomfortable. I can tell by the way he approaches my wife and I to fix it. Poor Papa. We'll get you better. He still insists on going outside and play, and nothing can stop him from guarding the house. It's time to get him to the vet. Let's hope it's nothing major. X-rays didn't reveal any breaks or fractures, so our vet referred us to a specialist for further diagnosis. Dr. Lang and his staff at the Dallas Veterinary Surgical Center were incredible. This is Tonka a few hours after the exam and on medication. He's a little drowsy and out of it. Tonka is diagnosed with a probable left shoulder soft tissue injury. He has to adhere to a specific treatment plan for recovery. If he doesn't improve in that specified time, then he will need to return for an MRI, further diagnosis, and possible surgery. The difficulty will be keeping Tonka rested for the first 2 weeks. He's highly energetic, extremely explosive in his movements, and none of that bodes well for his recovery process. The simple act of sprinting to the door when someone drops off a package is enough for him to re-injure himself. In order to keep those situations from happening, Tonka always has to be on his leash or in his crate, which means he and Velox cannot play for a minimum of a month and probably more. Dr. Lang recommended surgery as a last resort. Assuming that his diagnosis of a soft tissue injury are correct and that there are no other underlying issues, this is Tonka's best pathway for success. The doctor also mentioned that there could be osteoarthritis or a tumor. This type of injury can take 3 months to heal, longer if there are setbacks along the way. Tonka is in excellent physical condition. If any dog can heal well and fast, it would be him. We just have to be diligent, especially when it comes to Tonka and Velox playing. In addition to anti-inflammatory medicine, sedatives may need to be prescribed to help lower his energy and keep him from re-injuring himself. I was extremely impressed by Dr. Lang. The amount of physical time and effort that he spent with Tonka, as well as explaining all the different scenarios to me, was impressive. He could have very easily recommended the more expensive option, but he didn't. I'm confident in his diagnosis and his treatment plan. Tonka loves to sunbathe. He'll do this until it gets too hot, then he'll be ready to go in. You've got your work cut out for you, big boy. Now let's get to it. The doctor recommended that we stretch Tonka before walking him, as well as give him massages throughout the day. We have to keep that shoulder mobile. Tonka absolutely loves it. The more attention he can get, the better. Cane Corsos are known as this big, intimidating breed, but as you can see, they're absolute suckers for attention. Rehab for this type of injury requires that your dog not be overweight. Fortunately, Tonka's weight is perfect. We always watch it closely and feed based on metabolism and activity level. Overfeeding a large breed dog is the last thing you want to do, yet I see it all the time. The stress that it places on their joints will affect them sooner or later. The motion you see me using with Tonka is the same motion he uses to stretch. The difference is he does it on all fours. That's why his reaction is so relaxed. It feels good to him. Basically, I'm doing what he physically can't right now. If rehabilitation therapy at home is not successful, then we will need to make an appointment with a rehabilitation specialist, which could include underwater treatment. It's been 2 weeks since Tonka's diagnosis. As you can see, his mobility has gotten a lot better. In addition to his therapy, we switched to one of the glucosamine brands that the doctor recommended. He absolutely loves them. Tonka's road to recovery is headed in the right direction. We're looking forward to his continued recovery. Thanks for watching.